Well, what an interesting thing. I'm going to ask a question because you brought up sort of your cowboy medicine idea in the beginning, and I had read some months ago about and the interwebs are filled with lots of things, as you and I both know. But I've seen things repeatedly about vitamin D, and that may have some benefit. Do you have any thoughts about that? Is that just you know quackery, or anything positive to say about vitamins or vitamin D or anything?
Well, yeah. It's always a risk benefit, ratio of zinc and vitamin D. And, vitamin D is very low risk. There may be some mounting evidence that vitamin D helps protect related to severity of the illness. The mechanism, I don't, really don't have the background to ascertain why, but I did
Sure.
see, sort of a little abstract that I was reading on one of the med lines. There's a couple of news feeds that, just should give you daily updates related to, different things in medicine. Most of it is COVID related, but not always. But there was about vitamin D in moderate doses, may protect, limit the severity of COVID infections. But it wasn't a randomized clinical controlled trial, so it's hard to really draw any conclusions from that.
Yep. Have you?
We need vitamin D in Vermont anyway, so it's not.
I was going to say,
in the wintertime, a couple thousand IUs of vitamin D is probably good for all of us.
Exactly. We need it anyway. Exactly. Do we have enough experience at this point, or is there enough data to speak to any lingering symptoms or lingering side effects or anything? Are you starting to have questions from patients about that?
I think it's of significant concern that, we're fortunate that we really, I can think of the number of outside of the nursing home setting, the number of community acquired COVID infections that I have had in my practice alone. I can think of, on one hand, the number of people that actually required hospitalization.
Mm-hmm.
And I can think of 3 people who have significant lingering effects now greater than 6 months.
Mm-hmm.
And it's all unknown, that, what's the long haulers, that I think they've been identified as the long haulers. And they really sort of fall into 3 categories. Fatigue is probably one of the biggest categories.
Mm-hmm.
Pulmonary, lingering the pulmonary effects, and the third being cardiac, whether it's the cardiomyopathies or thing. And there's various UVM. One of the pulmonologists, one of the lung specialists, is developing a little research looking at the long-term pulmonary effects. I know there's a group down at Albany that are looking at the cardiac of a patient that's going down from a cardiology standpoint. So, and I think the fatigue is, and there's a lot of parallels back to, the Tony Komaroff days of chronic fatigue syndrome, and that was probably triggered by some, viral infection. And, there are people, it's not as prominent today as it was, 20 years ago. But that is a concern, because there isn't a diagnosis for it. It's a subjective, I guess you can do an MRI and look at the heart and identify the cardiomyopathy, and you can look at the lung damage from those people. But there are a lot of people that just have this significant constitutional effect, fatigue. Usually the taste and the smell, which is a very common primary symptom, usually recovers.
Mm-hmm.
It is a concern, and just given the size of the pandemic and the number of people that have been infected, it's going to be an ongoing concern.
Yeah. I'm wondering about kind of along those lines with any words of advice about sort of ongoing self-care or anything since the pandemic. I think about things like isolation and loneliness, and people. Are you seeing people gaining weight or losing weight, or
Well,
So
there's two, it's interesting. There's two categories of the people. I've had this a couple of occasions. I've been stunned where
Yeah.
people came in and I saw you've lost like 20 pounds or I mean, particularly if you're older and you're losing weight, that's not a good thing.
Yeah.
If if you're losing weight for no reason, then I go in and his wife is the next patient and she's lost about 20 pounds too. As it turns out, they go out to dinner 4 nights a week. So now they're home cooking for themselves. They're not eating the ample portions that we get when we go out to dinner.
Right.
And their weight loss was the fact that they're eating at home and not going out to eat. Myself, I'm a victim of what I call it the COVID carbo cravings.
Yeah.
And so, we're not as physically active. We're not going to, or we haven't been going to our gyms. We haven't, just because we want to we stay isolated. And it's going to be very important moving forward, particularly as the seasons change, to feel comfortable getting out, because we know open space, mask on faces, open spaces, and wide open places is to get back to that the physical fitness. I am not aware of any hospital, emergency room, doctor's office, eye doctor clinic, dental clinic where people have acquired COVID.
Yeah.
So, get your health care attended to, whether that's just routine preventative services, whether that's, followed up for whether it's your diabetes or your, high blood pressure, your chronic care type to get back on those routines. The gastroenterologists are back doing their colonoscopies and, so we can do that. But it's but still going forward, it's going to be, get our vaccinations, do our mitigation, but try to, get back to that, those healthy habits that we tried to acquire over the course, because there clearly has been a ton of isolation. The number of people, there's not a half a day I go through where I don't talk to at least one person face to face in the office who is just, they're lonely, they haven't seen their family, they're not sleeping, particularly the older single person who, either a widower living in, one of the silver palaces or in the home by themselves. The family drops Sunday dinner off at the porch and, wait. What the nursing home has been terrible. I mean, I have one woman who's not been out of her room and literally not been out except for her Monday and Thursday bath or shower. She refuses to come out of her room.
Wow.
But we're going to be able to get families back into those facilities shortly. We're going to be able to get families back into congregate living facilities shortly. People are going to be able to go out and, go to Sunday dinner, shortly, which is it's essential.
Yeah. And once I've gotten my two shots, I think we have a pretty generous and giving crowd. Would we be able, I'm just trying to think, can we do anything for those folks that are feeling isolated? If I've got my 2 shots, can I safely think about visiting the nursing home? Or are they going to turn me away and say, we still need to keep you away from here?
Well, that's unknown right now because the visitation into nursing homes is going to be restricted to a family member.
Right.
And to, shall we say, I want to say custodial vendors. So if somebody's going to come in and the beautician's going to come in and do hair, or the podiatrist is going to come in and do some nail care. They may have, if somebody comes in on Wednesday afternoons to play the piano, type thing. But I would encourage people, all of these facilities have volunteer coordinators, social service coordinators. I know I've worked pretty closely with the volunteer coordinator for the Vermont Respite House and trying, because, even visitations at end of life are allowed, but they're somewhat restricted, particularly if we have large families and, what have you. But,
Yep.
It's probably going to be up to the preferences of particular facilities and, both from a community organization, how are they going to, expand their volunteer services to community services, but with mitigation the same way with the facilities. So I think there's still a lot to be known because the door is not going to be wide open. I don't think the door will ever be wide open again, but at least for a long time.
It's interesting how the world has changed. I want to come back to that in a minute, but I'm along the same lines of generosity and caring. I've read a lot in the press over the last few months about physicians, nurses, healthcare professionals, and and the stress that all of you guys have been under. Do you have anything to share about that? And also, what can we do as sort of caring folks in the general population to help support healthcare professionals in the community?
We have, I mean, not working in the hospital and realizing the volume of patients in our local facility. I mean, we have been extremely blessed. I mean, our hospitals aren't running over. We've never needed to use the military, startups, what have you, that the stress in the system primarily were testers, people who were working at the pop-ups or over at the Fanny Allen or the fairgrounds that were doing testing, and then up in Franklin County. In the primary, what we do, we see very little COVID. And the reality is, in the outpatient, COVID is not very hard to take care of. There's nothing to do. It's supportive. You need to know when somebody's sick enough to go to the hospital. Many years ago, when hospitalists were invented, that most community-based practitioners, they maintain hospital privileges. But I mean, I haven't set foot in the hospital to care for a patient for a long time. Mm-hmm. There was a subsector of us that were extremely stressed in the nursing homes. I mean, mm-hmm. Claude, my nurse practitioner, and I were the only feet on the ground in that facility, probably for a good 2-3 week period of time when COVID was rampant. It wasn't rampant when COVID hit our facility, but then again, nobody knew what to do last March. Mm-hmm. We had no testing. We couldn't test the whole facility, and and so there was extremely. If any of you read the New York Times article where I was quoting saying I figured everybody was going to die, and they didn't. Good, but at the time I really thought everybody was going to die.
Yeah.
But then flash forward, 9 months with all the mitigation and all the testing and all the PPE, and then just in our community, up on North Avenue, it got in the building, and both the long-term care facilities on North Avenue got devastated. And I know the staff got devastated and the nurses got devastated. And, I know a couple of my colleagues, from doctors that worked in that community, and I don't know, support, you asked me that 9 months ago, I would say support and understanding, the nurses, and we were getting threatened walking in the door. We were being called murderers. We were called villains. It was our fault. We were killing these people.
Wow.
But then, 9 months later, everybody, same thing going on in North Avenue, and everybody was like a hero. They were doing hero. I mean, it's just how this thing has evolved by the understanding. But I don't know, maybe every once in a while a thank you, but, because, it's, but, we in general are a very caring community. Mm-hmm. And, a day doesn't go by when people, thank you for what you do. And, that's, because it is, and everything, you work hard, you do it every once in a while. It's like, oh my goodness. And then all I'll take is, one person to say one nice thing. Now, there's probably some people on this call that are retirees. They play golf, and it's the worst game of golf you ever had in your life. And you sink that putt on the 18th hole, and you're coming back the next day. Every shot could be, but you make that one shot, the last hole, and I'm good to go for another round.
Right. Well, good. Well, I hope you'll hear some thank you from my part, and I know from the folks that are joining, and also. I believe it's true that the community health centers do accept donations, charitable donations. So if people feel like giving to the community health center, they could certainly do that. Isn't that right?
Yeah, that's correct. I mean, they do. They actually rely a fair amount on philanthropy to support a lot of, because the community health center, particularly the community health center of Burlington, is a very, they have many, many things that they do, right, related to taking care of the homeless, and they have the youth program downtown, and they have, right now my nurse practitioner works in a nursing home. She's out doing, vaccinations at a lot of the, the motels where, the state has been supporting people that have housing insecurity or the homeless, and providing care for them. And that's all done through the community health center. I mean, with conjunction with other state organizations. So yes, the community health centers of Burlington does accept and does depend on philanthropy, quite heavily to support a lot of their unfunded. And, and then we're all economically stressed in healthcare related to not having as many patients in the office because we can't.
Mhm.
The reimbursements for telemedicine aren't on par with what face-to-face, reimbursements were.
Wow.
But, the federal government, both the state and federal government has recognized that and has made it, that we've been able to, with the exception of dental that had to close down for a while.
Mhm.
But that probably had to do with all the things that dental had to do to stay safe and still perform dentistry. I mean, they had to make some pretty significant material changes to, ventilation, type thing to be able to continue to safely practice.
Yeah. Yeah. Good. Well, thanks for that. And if people are inclined, I'm sure will want to support the community health center. We got a question that came in, and I'll remind everybody that we have a few more minutes. Go ahead and queue up your questions, enter them in the Q&A or the chat. But someone asks if they're not sure what the state guidelines are now, but if both myself and my spouse have been vaccinated, gotten our 2 shots, and same with our best friends, shouldn't it be safe to have them over for dinner?
Absolutely. And I think Dr. Levine mentioned that. I was listening to that just as we signed on to the podcast this morning, where there have been the governor made some announcement where he is allowing small groups, families to gather.
Mhm.
And then I think even last week when they talked about nursing homes, that even if you haven't been vaccinated and you have a loved one in a nursing home that has been vaccinated, it's up to the facility. But they encourage Secretary Smith and Dr. Levine encourage people to visit their family members and loved ones in the facility. So I think that's extremely. I mean, I think we have to follow the same mitigation. That I wouldn't have a party of 15 in a condo across the street at the Pines, but
Right.
I think with reasonable precautions and mitigation, definitely sounds like Sunday dinner is a good idea.
Yeah, I think so. But there is a waiting period that you mentioned before. Wait 2 weeks or
Yeah,
something.
the understand for that's really for the travel. But it's still. I mean, for to be maximally protected, it really is about 2 weeks after your second shot.
Yeah.
And as of today, it's for the next 3 months. Hopefully that will be extended when we get more evidence. But right now it's a 90-day period.
Mm-hmm.
And there's nobody that I know that's been immunized for more than 3 months.
Right. Exactly. I want to go back to the idea of the new normal for a minute. You talked about, you don't know in nursing homes or in certain facilities if we'll ever go back to kind of the same routines. Do you have any other inclinations or observations about what we might experience as a new normal? I mean, you held up your mask a few minutes ago. We were talking about flu season. Moving forward, if we're a year or 2 down the road, do you expect? I know you don't have a crystal ball, and I'm reluctant to look into mine too often. But any patterns or anything that you suspect or think about what the new normal might look like?
Well, I think we're all going to have a much keener awareness of the threat of a pandemic, because it will happen again.
Mm-hmm.
I know that both the state of Vermont and New York have already issued, sort of mandates to really relook at the vulnerable populations, starting with the nursing home, facility. And that's been part of, what I've done professionally for 25 years. So I really suspect there's going to be significant, long-lasting change in infection control, measures and quality assurance measures in those types of facilities. And I think preventative, I think we're going to be looking at, different, types of immunizations, going forward. And, is mitigation, maybe if we can eradicate this pandemic and, be able to go to concerts out on the greens with, tens of thousands of people, it's, I don't know. I'm waiting to see how many people will be, in the baseball stadiums this summer. Are they going to open up? And you're going to see there's going to be regional preferences. I suspect Florida and Texas are going to have more people in. Well, there's really never too many people at a Marlins or a Tampa Bay game, but that's a different that's a different story. Are you going to have 50,000 people in Yankee Stadium for the 4th of July? Probably not.
Yeah.
I think in that world, and I'm a sports geek, and I'm, that's really to watch with nobody in the stands, I think it's going to be a while, I think, before that changes, both in the standpoint of people who sponsor and organize the events, and I bet you also from the population. Are they going to come? Are they going to, so it'd be interesting to see how that evolves. But, this hit a raw nerve, I think, in many people, and it's going to be regional. I mean, my daughter lives in Tennessee, and just to hear stories about how, I guess I'm biased when I say how careless and non-caring most of people in Tennessee are related to COVID. It's frightening, but that's
It is interesting, fascinating, the regional differences. That's for sure. Yep.
The fallout to this too that hope will never change. It's unbelievable, the worldwide and national collaboration from the standpoint of science.
Yes.
I mean, most science came to a standstill, and the whole world jumped in feet first to understand this thing, and just the amount of research that has gotten off the ground, whether it's the blood clotting, whether it's the immune reactions, whether it's the whole vaccine programs, and I think that they've learned by not having to keep trade secrets and collaborating, the amount of wonderful work that can be done in such a much shorter period of time. So hopefully that won't change. I think there's going to be some good things that are going, come out. It's not going to be the number of people in the Yankee Stadium, maybe, but it may be. There's a ton of wonderful things that have happened on the research and science side of things that have just been, breathtaking.
Well, and hopefully awareness of science and awareness of just basic epidemiology and community health kind of issues. I feel like in the last year I've gone through a mini course in epidemiology just by paying attention to the news every day and listening to yourself and Dr. Levine and Dr. Fauci. And, we all certainly can benefit from knowing more and from facts and paying attention to science. I think.
Right. Public awareness. Yeah, absolutely.
Yep. We're getting close to our time, and if there are any more questions, I'd urge people to bring them in. We've been addressing them as we go today, but I guess I wanted to give you a chance, Mark, to ask if there are any additional stories or messages that you'd like to share, anything that you think that would be important for this audience to know about from your experience with the pandemic over the last year.
We covered it a little bit, but I did write, one thing down on my little piece of paper, and it's just the emotional toll that this has taken on particularly our seniors.
Yeah.
That, we've been fortunate from those of us that are still working, to collaborate, whether it's virtual or face-to-face with people that we work with, or we have, families and we talk to our kids on Zoom or whatever. But the number of people, particularly our elderly, that have been isolated. And if we say one thing is to, pick up the phone and, call and talk to somebody, or if you feel comfortable and you had your vaccine, invite yourself over with a bottle of wine and whatever, because I have the collateral, we've had a certain number of people that have been infected, but the number of people that have been affected by COVID is just, multiples. And it's just, as I said, a lot of our, elder population are single women. I mean, that's, who I think, but that not necessarily. I mean, there's just as many Now, obviously there aren't just as many single men, but just our people, our senior citizens that are living in isolation and some fear, it really has become overwhelming. I think the vaccine has become, it's like the light at the end of the tunnel to some degree of liberation. But, I think there's going to be a lot of, residuals from essentially a year of solitary confinement.
Mhm.
So,
Well, thanks.
so if we can just, reach out and, say hi and, because there's still a lot of people out there that haven't really, associated or seen people for a long time.
Yeah. Well, thanks for that message. I hope that we can all find ways to do that and to pitch in. And other than thanks, anything else that we can do to help you and your colleagues in your daily quest to looking out for our health?
As you mentioned, like from a philanthropy standpoint, if you, feel the opportunity to reach out and see how you can help your local healthcare organization or the FQHC, or whether it's your hospital, whether it's, the visiting, home health. We got a lot of shut-in people. If you know people that aren't able to get out, because right now we're still trying to find those people who are homebound and shut in that don't have home health services, because we have a mechanism to get them the vaccine. We just got to find out where they are.
Yeah.
So,
Yep.
But other than that.
Okay.
All right.
Well, good.
Thank you,
Thanks, Mark.
Michael.
Thanks for joining us. And thanks, everyone. We'll be sending out a quick survey after we log off. Please, we love your feedback and your input. And Mark, thanks for taking time with us today.
Okay, my pleasure.
All right. Bye-bye.